Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening. Hope you're keeping warm under lockdown level 3. A little bit of ease we've seen, alhamdulillah, shukr. We also have to praise the Almighty, thank the Almighty, and keep all those in our prayers. Lots of families are struggling with COVID-19. So we continue the discussion of COVID-19. I'm Khawa Solomon. Stay with us in the next hour. We talk about anxiety around the children and the parents and how everybody's feeling about going back to school, even the teachers, support staff. We also have some taxis back on the road as well, but we've also seen some taxi strikes. So transport being an issue, how is everybody coping? Is your school being accommodating? I know that most schools are not meant to, that these schools are not meant to be completely full, so they're easing in the grades. So please do interact with us. We'd like to know from you what is happening on your side. Our WhatsApp line is available, and not too sure if the live call-in will be open, but we're trying to have conversations rather with our specialists. So please do WhatsApp us. It's an easier form of interacting with us. So WhatsApp your questions, comments, and queries throughout the show as we discuss anxiety, the stress, the worrisome around back to school, the kids back at school. So first we chat to our in-house doctor, our specialist doctor, Dr. Fatima Baba, but today she's going to be carrying the hat of a parent. I've been chatting to her often, and every time I speak to her, then homeschooling comes in, balancing, getting to work, the kids being at home, and, are the kids back at school? So she chats to us as a parent, as well as our in-house doctor, Dr. Fatima Baba, and later on we speak to clinical psychologists and find out from her how we can cope. What are the solutions? How do we manage this anxiety, this worry of our children going back to school? What is your school doing? What are your children's schools doing? Are there open conversations with teachers, bodies, the parent bodies and principals? So please do interact with us. You make the show. So tell us what's happening in your community. We will be also giving you some helplines. A representative from SEDAC will chat to us a little bit later on. That is the South African Depression and Anxiety Support Group. They are an open line working 24/7 there to help and assist our parents and individuals struggling during this lockdown. So now let's connect with Dr. Fatima Baba. Assalamu alaikum to you, Doc.
Walaikum salam, and assalamu alaikum to all our viewers. Like how I said, I hope you all staying warm, safe.
I must also add that Dr. Fatima was having some connection issues, electricity issues, in fact. We're not going to point any fingers, but at the moment there was some connections with her. So she's going to try her best to connect with us in a couple of minutes. Understanding that people's electricity are down at some areas. I experienced that just before we came in. We cooked on gas, but we still got the meals going. And then there's individuals that actually do not have any electricity. So we have to think about those and lend a hand out for those that are struggling with the circumstances during lockdown and COVID-19. Again, I reiterate, please do support those in isolation, in quarantine. I just got a message today about very close family members that have been rushed to ICU due to their COVID-19 positive status, and also wanting everybody to keep those in their du'as. Last week we spoke about the loss. Quite a few messages still came in about individuals that never got to see their loved ones when they passed on, or even to attend the janazah. We will also connect with both the provinces' representatives when it comes to the deaths and the janazah arrangements. I know Durban has a very well set up janazah khana where there's the ghusl, where they make their salah, and also the gathering so that the family of the deceased can attend the janazahs. Please do interact with us and let us know what are your struggles during COVID-19. The WhatsApp number is also available, so we would like to connect with you with your troubles during this lockdown. So let's connect again with Dr. Fatima. Are you back with us?
I'm back with you.
Alhamdulillah.
So
okay.
Talking to you as a parent, it's a different hat. From the other side, it's really, I think when schools opened on, in March for the children, well, not in March, now on the 1st of June, around thereabouts for the grade 12 and the grade 7. I can just tell you that in my house, I've got two sisters, one with a daughter in matric and one with a daughter in grade 7. And just the anxiety levels were out of this world. You're thinking, where are the children at? Are they going to be social distancing? Are they actually going to do what they're supposed to be doing? And I'm not sure if you people have seen, but there's a lot of memes going around where people are making fun of the fact that kids are actually going to swap over their masks and say, give your mask to me, let me try it on, whatever. And as a parent, for the elder kids, you don't think about it. But for the little kids, that's something that kind of comes into your mind all the time. I'm thinking, my little 5-year-old is saying, I just want to get to school so I can hug my friends. And I'm thinking, God, do you want to go to school and actually do that? So it's a catch-22 situation. And I think as parents, we've got to control our anxiety, just in terms of the children actually mimic what we are going through. So if we are anxious and depressed, that's really what the kids are going to be portraying.
Absolutely, and sort of understanding as a specialist, being in the medical field, you know the science behind it. You understand those that are more at risk, those that actually need to get it. So we work to the herd immunity jargon again, and it's something that we're all afraid of. So do we even have underlying conditions? Are we saying that our children are okay? Parents have this anxiety to say we don't want to use our children as guinea pigs. So as a doctor, as a specialist, and as a scientist, you sort of understand it, but many people don't.
The thing is that I think and this may be very generalizing of me to say this, but I think the parents who are not doctors are actually handling it a lot better because they're going with what the doctors are actually saying to them. So if a patient comes to me and says to me, doctor, what do you think? Should I be sending my child to school? And I go, yes, it's fine. Your child can go to school as long as there's social distancing and all the protocol is in place. Then I go back and I get on to all my medical groups and I get on all. I, as a scientist, like to say, we're reading and we're seeing all these things, and we're just not coping as well as another parent should.
Yes.
And I realized this when my kids go to a school that opened 2 weeks ago already. So my 5-year-old and my 6-year-old started school 2 weeks ago. So all the parents have actually sent their kids back to school, but my kids are still at home.
So why have you chosen to keep your children at home?
For me, it was twofold. I go to work every day, and I am a high risk coming into my home. So I am then sending my kids out to mingle with other people's kids, and I don't think that's fair. So that was my first reason. And my second reasoning was, I don't know what the rest of the parents are doing in terms of work-wise and social distancing and socializing. And I think I made the right decision because a week into school, one of the people tested positive for COVID. And those 9 kids had to then isolate, and their parents had to isolate because a 6-year-old doesn't understand isolation or quarantine. So it's nearly just a domino effect.
Yeah.
Having said that, though, we're in a very precarious position, whereas we've got to live our lives. We cannot keep them at home forever. And yet we've got to then educate them. So at the moment, we go through a drill. So when we go through it, it's like, please put your mask on, please put your shield on, show me how you're going to be when you're at school. Sanitize your hands, wash your hands. We've got to educate them. We've got to teach them. I mean, the elder kids will understand it's easier for them than it is for the little.
Just to explain to some parents.
I didn't mention this before.
Sorry,
and I don't know if listeners heard this.
Yeah.
But little children mimic what their parents are doing.
Yes.
So if I go back to week one of we in homeschooling for 10 weeks already.
Alhamdulillah.
So if I go back to week one, I was an absolute mess.
Yes, I
I
remember.
had no routine. I had no idea on how to teach them. I had no, I mean, for me, it was almost a block. I'm like, I'm not a teacher. Why am I doing this? You know, what is going on? And then I go out the house to work. So I'm not a mom who's sitting at home on my computer and I can say, okay, do this, do that, kind of thing. If I'm not at home, they're not learning.
Yeah.
So I didn't have the balance. And I think as parents, if we can just strike that balance for ourselves, as the weeks went by, I noticed my kids calm down. I noticed
because
the
you were
tension
calm
in the house calm down.
Yeah.
Exactly.
Yeah.
Because I had then just basically come to a realization where I phoned up to school and I said, look, the days that I go to work, unfortunately, my kids cannot do any work. So they're going to do work on the days that I'm at home.
Yeah.
And a lot of the schools are very, very accommodating. I must say they're very good. But having said this, we now have to look at it from the public sector as well. So I am a mom who's in a private sector, right?
Yeah.
And my anxiety levels are through the roof. Can you imagine a mom who's at home, who's got no data, whose kid has been home for 3 months now?
Yeah.
Not a single day of school. Or they've got to do schooling via radio or WhatsApp or those avenues. And I think as a community, we've got to provide extra support to those mothers and those parents and those children, because they are in an absolutely different situation to us.
Yeah.
We have the access to amenities and privileges that they do not have.
Absolutely.
And I think our discussion with Dr. Viwe will be really important from that perspective, because those moms need to do sort of the same kind of calming routine. They're picking up. Having said that, though, I know a lot of friends of mine who go to public schools, and the public schools have stepped up like you cannot believe.
Yes, they've been very good.
They are doing a brilliant job.
Brilliant job.
Parents can come in. They're giving them sanitized, school material.
Dr. Fatima, if we could just hold that thought for a second, we need to take a quick break, and when we come back, we will bring our clinical psychologist in. We have Dr. Fatima Baba as a parent discussing the anxiety and the worrisome issues around sending your children back to school. But more just after this. Stay with us. Assalamu alaikum wa rahmatullah. Welcome back. We are chatting to Dr. Fatima Baba, our in-house specialist doctor, and now we have online clinical psychologists to all break this down and make us understand what is behind the anxiety and the worrisome some parents are having when it does come to sending their children back to school. So please do WhatsApp us your concerns, your questions, comments during the show. Unfortunately, we won't be taking your calls, but let's hear from you. What your school has, as Dr. Fatima said, the public schools has been doing very well with regards to their planning, getting parents involved, letting them be there, doing the social distance, and even us going out doing our immediate shopping or still going back to work, we are still social distancing, wearing our masks, our visors, and sanitize. So coming back to our clinical psychologist, Viwe, she's based in Johannesburg and has a passion for empowering through mental health, especially depression and anxiety. So now let's chat to Viwe Dweba. Very good day to you, Dr. Viwe. Thank you so much for joining us.
Thank you so much for having me.
Okay, you are a little bit faint. Let's just get that again. Can you hear us?
Sorry, I'm really struggling with audio
there
right
we go.
now.
There
There's
we go.
a lot of feedback from your side.
Okay, That is much better, much better. So we can hear you. Thank you so much for your time. So welcome to Health Matters and ITV. We appreciate your time. We've understood that there are parents that are quite anxious sending their children back to school, and those that have chose not to, like Dr. Fatima, because of her circumstances. But there are individuals that or parents that are saying, I'm not ready to send my child back to school. When we had our introduction meeting with my children's school, I remember one of the nurses, a professional nurse, saying that, listen, I'm not prepared, or I'm not ready. And one of the fathers as well said, I'm not ready to send my child back to school. These are my fears, these are my concerns. And it's great that the school are accommodating, but how can parents get through that pothole of eventually sending their children back to school? What are the pressing anxieties that they can deal with to put aside when it does come to sending their children back to school?
I think the first really important thing to consider is the fact that children are the most vulnerable part of. They're vulnerable and they're impressionable. So they are like little sponges absorbing their parents' anxiety, actually. So something that's really important for parents to do is actually to deal with their own anxious feelings around returning to school. And these anxieties, of course, are founded in reality. They're based in reality. They are, the fact that we can't really see who has COVID a lot of the time. So we don't know how. So it's really important. Sorry?
Okay, so you may continue. I know there is some feedback, but please do continue.
Okay. So I was saying that the first thing to do is, sorry, I'm really struggling. There's a lot of feedback.
So you can just continue, Viwe. Apologies about the sound. Yeah,
There's
we can hear you.
a lot of difficulty in terms of children absorbing their parents' anxiety. So it's really important for parents to work through their own feelings.
Okay, so I think, Viwe, what we're going to do is just do a telephonic link with you, which will hopefully eliminate that feedback and that sound. So we'll just disconnect with you for a second, and we will connect with our clinical psychologist, understanding, as Dr. Baba just mentioned now, that yes, her children were feeling anxious, and they were feeling uneasy about the situation the first week of lockdown. But it is probably and most on top of the list is because she was anxious. She had all these concerns about what she's going to do, how is she going to cope. She's not a teacher, and we were so good in sending our children to school to the teachers, and that was their strength and their ability. And here we had to automatically, with some being at home, working from home, now having to cut their time and now be teachers. So manage their children's time. And we know sometimes when the kids are off at school, it also does give us a bit of a break if we are at home and we get to do the things. So that was interrupted as well. So as Viwe, our clinical psychologist, mentioned, that children feed on parents is anxiety. So Fatima, coming back to you, if we can sort of understand that, you mentioned that schools are doing their best and they're doing the necessary to actually help ease the fear of anxiety, because that's often what it is, the fear of unknown, and then you have all these emotions.
How our schools are doing a really good job. I must give you an example. So there's a school in the area that you live in, and just to, calm parents down, they basically sent a video through of a teacher coming to school, walking through the whole process that the kid would ideally go through.
Okay.
And show you that the child will be sanitized, they will walk on this path, these are the markings, the distance that they will stay away from each other, these are the desks they will be sitting at. A lot of the schools are providing children with visors and masks. Having said that, please, viewers, a visor does not substitute for a mask.
Okay.
It's very important to remember. A visor is a visor that's for your eyes, a mask is for your nose and mouth.
Okay.
So it's two different things. So a lot of the schools are doing that. But having said that, and just being a parent myself, um, the anxiety still doesn't go away. You've got to actively every minute of the day go, am I behaving like a mad woman? Are the kids watching me? Are they seeing me? Okay, this constant fear that I have that they're going to go out and they're going to get COVID, or I'm going to go out, I'm going to bring it in. Um, it's this balancing act that is putting a lot of adults in a lot of stress. Um, and then we add on that for parents the financial burden that's coming with the COVID. So unfortunately, the, the anxiety needs to be. Like I'm saying, I'm the parent. So I'm talking from my, you know, I've got generalized anxiety disorder to start off with. So after I got diagnosed with cancer 11 years ago, I got diagnosed with generalized anxiety. And life was peachy, and then COVID happened. And now I sat back and I thought, what am I going to do? And I have genuinely restarted my anxiety medication because it was absolutely necessary in order for me to be a normal functioning person. And I think that the viewers out there need to understand that if you've got a problem, get your meds, sort yourself out, and so you can be a better parent to your kids.
Absolutely.
So let's hear from till I was yoga out.
Sorry, let's hear from Viwe. She's back online. Hi, Viwe, are you with us?
Yes, I'm with you.
Okay, great. So I hope that sound is better. And as Dr. Fatima, reiterated that we need to sort ourselves out first, like literally putting it plain and simple. As individuals, if we have anxieties, that's what our children latches onto, and as you rightly said.
Yes, definitely. So as I was saying, children are very vulnerable and they tend to take the emotional lead from the adults around them. So especially with our small children, they may not have a full understanding in the way that we have a full understanding of what this COVID pandemic means. But they may have their own worries around getting sick with the limited understanding that they have as kids. But for the most part, kids will be absorbing their parents' anxieties. So for the very first thing parents need to do is to figure out how they're feeling about sending their kids back to school and dealing with their own feelings so that they're not projecting that onto their children, who will then absorb it and take it on as their own feelings. Helping some of this anxiety can be very practical as well, in the sense of the school, parents contacting the school and finding out what their policies around keeping the children safe are. So this anxiety is important to actually just normalize it. It's not irrational. There are very real risks. So with real risks, you need real answers, and there are answers to the questions that parents have. There'll probably also need to be a conversation with the children around what it means to stay safe at school, encouraging children to wear their protective gear, but also normalizing the children's feelings around the inconvenience of wearing protective gear. Because remember, some of these are little kids, and some are teenagers who want to hug their friends and have some of that physical touch that they've been missing so much during the lockdown. So it's so important to normalize those feelings of longing for a hug and longing to hold hands with your friends, but also then to speak to them about how it's important to still wear your protective gear and to adhere to our safety regulations, and also to reassure them that the grown-ups around them, that the people who have studied long and hard to find a vaccine for this virus are working tirelessly, and that people are looking for a solution. So this may feel uncomfortable and painful right now, but it is in fact a temporary situation.
So often, kids, you think that they are vulnerable, they're not going to understand. And I must say, during this lockdown, these couple of weeks, these couple of months, they have done absolutely brilliant. How do we affirm them in some positive, conversations?
I think what you're saying is really important about affirming behavior that is helpful and helps to keep them safe. So it's not just about criticizing children when they're not, or they forget to adhere to safety regulations, but it's also about positively reinforcing safe behaviors. So this is also about, especially with the little kids, really celebrating when they remember to wash their hands. Giving them a kind of a reward in terms of give them a hug, give them some affection, really reinforce them, high-five them in playful, age-appropriate ways.
Okay.
But it's so important to reinforce safe behaviors and not just to criticize.
We continue our conversation with anxiety and the stress around your kids going back to school. We know that the play schools also possibly are opening the end of the month. So do continue our conversation and stay with us via our WhatsApp line. You can tell us how you are feeling with clinical psychologist and Dr. Fatima Baba. We also have Sadek at the end of the show, so please stay with us. Assalamu alaikum and welcome back. This is Health Matters. Welcome to it. I hope you're keeping safe and warm. It's something like 8 degrees here in the heart of Johannesburg, Sunninghill, Sandton, and wherever you are, please keep praying. Ask the Almighty to help those that are struggling with COVID-19. They have been rushed into various ICUs. Their families have been isolated. Those that are not able to attend their funerals and janazas, there is some worrisome around that. But today we focus on the anxiety of parents and children that are returning back to school. We have online Viwe, our clinical psychologist, and Dr. Fatima Baba carrying the hat of the parents, and also giving us some scientific advice when it does come to protecting yourself. So Viwe, if we can get back to the issues around parents challenged with others' opinions. So often you say, yes, no, I'm ready to send my child to school. One of your relatives or your neighbor or somebody close to you or even another parent, like how can you do that? This is a personal choice that parents are making. And then there are parents that are saying, I'm good, I decided I'm going to keep my children home. So they varied opinions on this. So you kind of latch onto somebody else's anxiety possibly, and then you change your mind. What should we do with this information when it comes to a decision we as parents have made to send our children back to school, but there are others that are influencing us?
I think that we're all kind of overwhelmed with information at this point, and that can stir up a lot of anxiety, and in parents especially. So the important thing is about understanding that this is very much an individual kind of decision that you need to make. So it's important for each set of parents or any parent to make this decision based on what is in the best interest of their child. And there are a lot of factors to consider in this. One is about the health of your child as well. Does your child have any pre-existing conditions that might put them at, even more risk than the average child at school? Does your child's school have sufficient safety regulations around keeping the children safe at this time? But it's also really important to speak to our children as well and have them be, as is age appropriate of course, a part of this decision as well. Because we often don't think of children as having their own autonomous minds, and they do. And we're making decisions about their lives for them without even speaking to them. And that really exacerbates those anxious feelings of being completely out of control. So it's really important to include kids in this conversation as well.
So we understand a lot of anxiety comes from the unknown. What are the questions parents should be asking themselves, their children, or even the schools to ease that worry?
So with a lot of the questions that we have, there are actual answers. A lot of the burning questions that parents have are around wondering if the school has sufficient safety regulations in place, whether the school will actually adhere to these safety regulations, are teachers equipped to manage how, kind of the number of children in the class. So these are questions that can be answered by the school. So it's important for parents to actually make time to meet with grade heads or the school principal or teachers to actually discuss how the school is planning to keep their children safe. It's really important to ask your children as well about how they're feeling going into school, because sometimes children don't verbalize the fact that they're feeling anxious. But it's really important to open up a space and create room in your relationship with your child for them to be able to share how they're feeling, even when it feels uncomfortable to share those feelings.
How can we support other parents that are feeling anxious and would really like to send their child to school? And it is again about their issues and where they are at. How can we support other parents?
Well, how we can support other parents is, I think, by having conversations with other parents, talking to them a little bit about how they're feeling as well. But also it's important to consider the fact that anxiety is fed by more anxiety. As you mentioned a bit earlier, we can feed our anxiety with other people's anxiety. So it's important to also make sure that we have sufficient boundaries in these conversations so that we're not feeding into each other's fears. However, it's also important to have a supportive kind of space for parents. So maybe speaking to relatives that you have, or speaking to other parents who have children who are friends of your child who go to the same school perhaps, to kind of talk about what their thoughts have been, what their considerations have been around keeping their child safe, and what they might be concerned about, just to kind of think about it together, because also a few minds can be really helpful. But I do have to caution against feeding anxiety with each other's anxiety.
Okay, so when you say feeding, let us firstly recognize some of the symptoms, or sort of what presents for us when we see somebody's being anxious. Do we just mistake it for anxiety?
So with anxiety, it does come out a lot in how we speak about it and how we speak about things. So there's a lot of kind of catastrophic thinking that comes with being really anxious. In your talk, there'll be a lot of absolutes, like things will never be okay again. Things will always work out for the worst. So it's important to listen out for that kind of speech as well. Okay. But in terms of also looking at symptoms even in our kids as well, it's important to notice if a child's concentration is starting to really suffer at school, not sleeping well at night or waking up because of nightmares. Your child's eating habits might start to change. They might be a lot more irritable, so you'll notice more angry outbursts. And when they're angry and they're having an outburst, it's really hard to calm them down. Okay. With younger children who have been potty trained, there may be a regression to bedwetting. Also, constantly worrying or having negative thoughts, which again comes out in speech. So speaking in those absolutes, in catastrophic terms.
So if I could bring Dr. Fatima in, we do have literally a minute or so to wrap up. And I think from your side, Dr. Fatima, what medical questions and concerns can parents ask the teachers and the school if they are worried about sending their children back to school, just to ease that concern and be ready to send them back?
There's just a few questions you need to ask. You've just got to make sure that they have the adequate social distancing. It needs to be 1.5 meters between kids. The kids have got to have masks on. They've got to make sure. So I'll give you an example that a lot of schools are staggering the start times and the ending times of schools, so that lots of kids are not in the same area at the same time. Ask the school about break times. How are they going to do that? What sterilization methods are being used? What are they doing in terms of toilet usage? How many kids are allowed to go to the toilet at the same time? How are they controlling that? In terms of, monitoring staff that are traveling on public transport. They've also got to do, the normal screening, sanitizing before we go in and out. It's just the normal day-to-day things that we are all doing. We've just got to make sure that the schools are doing pretty much the same thing. And I think as parents, more than asking the schools, we've got to just reiterate these things to our children at home, Say to them as many times as you possibly can. Wash your hands. Don't hug anybody. Don't come too close to anybody. Keep your mask on. Don't take your mask off. Teachers and as parents, we have realized how overwhelming their job is. They are really, and now I would say teachers are now on the front line.
Absolutely.
And with the doctors. So we've got to, give them as much support as if we've chosen to send our children to school. I think we've got to take as much responsibility as the teachers are taking with regards to educating and making sure that the kids are adhering to, just the laws. I mean, the little kids, I basically tell I've got a 5-year-old and a 6-year-old, well, a 7 and a 5. I've got to tell them the same thing every day about 10 times a day.
Yeah.
And I think that's where the most important aspect comes in. And I'm not sure if WWEorg agrees with me. There was also a published article a few weeks ago about where just a little bit of earthing the kids, so getting them to walk outside on the grass barefoot, and also yoga for kids is very calming for the kids. And for us, I've been making my kids regularly read their salah, like try not to miss salah, because those postures are also just as important as yoga for calming purposes,
Absolutely.
And even just, zikrs apparently are very, very good.
No, absolutely. You cannot deny, your faith and your spiritual connection with the Almighty, does elevate you in some way. So thank you so much, Dr. Fatima Baba and WWEorg, our clinical psychologist. We will be connecting with SADC just after the break to find out some solutions in the way. Okay, so we're not going to a break. We'll chat straight now to our guest from South African and Depression, is the South African Depression and Anxiety Support Group. We have Venetia Gordon on Skype. A very good evening to you, Venetia. I hope you're warm wherever you are.
Hi, thank you so much for having me.
It's a pleasure. So we know that the counsellors, you being a senior counsellor and project manager for SADC, thank you so much to you and your team for your time. I know that everybody's doing social distancing, so it's from a distance that you guys are working for many, many years. In fact, talk to us about the support and the structure of SADC when somebody does call in needing some advice.
Okay, so SADC is a 24-hour call center. We help with counseling, containment, and referral to resources nationwide. We help with crisis management. We help with people needing any sort of help regarding mental health, regarding any help that a person may need. We can help you better manage it in that situation and in that moment.
Okay, so let's look at SADC's messages when there are concerns of parents, neighbors, teachers, in fact. What kind of advice are given to those individuals that have anxiety about sending their children back to school?
So, I mean, in this uncertain times, even a person who hasn't ever felt anxiety or hasn't ever felt anxious is going to feel anxious. This is a new normal that we're in. There's uncertainty with regards to what's going to happen in the future, what's going to happen tomorrow. We don't know. And I think it's so important for us to just, in that moment say, okay, what can we do right now? And on the website, if you go on the SADC website, www.sadag.org, you're going to find toolkits, you're going to find articles, you're going to find information there that can better help you manage right now. And if you're feeling extremely anxious and you're not sure how to manage it in this moment, please call one of our helplines or SMS us on 31393.
Okay, so 319 313?
3139393.
Okay, so that's an SMS that you can text to ask for help, and somebody will contact you back?
And a counselor will call you back.
Okay, so when people say, "Oh no, I shouldn't call," or "This isn't anxiety," how should they recognize their anxiety when it comes to the lockdown? Kids going back to school. Some people feel that they're not anxious about this at all. Do they still need to talk to someone?
I think definitely. I think if you're feeling unsure about anything, if you're not recognizing that, I'm feeling this way, I'm feeling extremely stressed, I'm feeling extremely nervous, I don't know what to do next, and you feel yourself stuck, I think please phone in. Even if you don't feel like you're feeling the worst, please phone in and still speak to a counselor, because it just might be that phone call that will make you feel better and put things into perspective.
Okay, let's talk about support groups. I know SADAG does, start up and manage various support groups in areas. Is that still available? How can people connect to support each other if it's not something that they need to speak to a counselor to, but actually to a parent that's possibly in the same position?
So the support group SADAG has been running over 200 support groups nationwide. At the moment, we are running a few of them online, not all of them, because in reality, the thing is, we don't want to have or aid anybody to be ill or anybody to be in a situation where they can get ill. So we would prefer doing the online just for now. And obviously, there's different needs and different aspects that come into play. But it's important to know that if you are not feeling well, you can phone the call center and gain that support. And then if you can and you are able to then join in on an online support group, and that is also a possibility.
Okay, just navigate somebody that is accessing your website. It's quite a busy website, and I know that it's equipped to help anybody, whether it comes to ADHD, whether it's support group, anxiety, depression, even suicide. So just help individuals navigate their way through the website.
So I think it's so important. I know it's a very busy website. There's things all over the place, I think, in different columns, in different spaces. I think the first thing you do is that when you log onto the website or you go into it and you type in www.sadag.org, you scroll straight down, you're going to find toolkits, you're going to find information, you're going to find different telephone numbers that you can contact SADAG. You'll see on the right-hand side, on the right-hand side, you're going to see a contact the counselor, where you can put in your details, you can put in your telephone number in the area that you're in, and that form will go directly to a counselor, and a counsellor will call you back. Also, there's numerous articles. If you look on the tab on the top, you're going to see all the different little topics there, and there's articles, there's videos. I think the videos are brilliant, as well as a few of the webinars that we have been doing through the lockdown. From the beginning of the lockdown, we've been doing webinars, and there's a very very useful and very, very vital webinar on the anxieties around children going back to school, as well as how parents can manage it, with Candace Cohen as well.
Oh, brilliant. So I'll be logging on to that, whether I have anxiety about it or not. It's a brilliant place to start and sort of recognize where you as a parent are feeling. So the hours again that you guys operate, the contact details, and I know everybody's not connected via social media. You've mentioned the WhatsApp line that people can call, the SMS line that people can send through, and somebody will, contact you if you need help.
Definitely. And there's also a 24-hour helpline. It is 0800 456789. You can go to the website. You can also put in your details there if you want a counselor to call you. The same with the SMS number 31393, and a counselor will call you back. So there's lots of different avenues that you can get help from SADAG, and we are here to want to help you.
Some of your concluding comments to those parents and children, and I think we as mentioned earlier, and we need to reiterate that the children have been doing absolutely brilliant during this time of lockdown, and recognizing how well they've been coping and handling something that they completely don't understand. So your concluding comments to our viewers as well, Vanisha.
I think it's so important to know that it's okay to feel stressed. It's okay to feel anxious. This is uncertain times. Nobody knows what's going to happen tomorrow and what's going to happen in the future. And we need to understand that it's all right. It's fine. And remember, those people that have never felt any anxiousness before are now feeling it. And I think it's so important for us to be aware of those feelings. Understand what the body is telling you and understand how you're feeling about things and ask for help. Don't ever feel like you can't.
Absolutely. Thank you so much, Venetia Gordon, SADC Senior Counsellor. So please connect with them. They are there to assist. Appreciate your time. All the best and strength to you and your team. We'll chat again soon.
Thank you so much. Thank you.
It's a pleasure. That was Venetia Gordon rather. So please connect with SADC, www.sadag, that's the South African Depression and Anxiety Group.org. You can also send them a WhatsApp for help, 31393, and a counsellor, an experienced counsellor will call you back with the necessary assistance that you need. The anxiety is real. Let's recognize it. Let's sit with it and ask the Almighty to guide us. And if we need help, talk to someone. Join us next week as we cover COVID-19 issues. Once again, please stay with us. Catch the repeat of the show tomorrow. Please tell your friends and family also to catch the YouTube channel of Health Matters on ITV Networks. From myself, wherever you are, keep warm and safe. Wassalamu alaikum and goodbye for now.